the road. I want to welcome everyone this afternoon to another edition of Public Leadership Institute's Policy Leadership webinars. We bring these presentations once every 2 weeks on a host of policy issue, communication strategies, and other information that is hopefully something that can help you advance your work in your local community and local state. This particular session, how to advocate for an economic repro agenda. There's the typo there. But I think it's even more appropriate just given our, coming off International Women's Day and the activities around the country in solidarity in defense of rights and importance of the role of women playing in the community, particularly as it relates to the economy. I think we're going to walk away with a lot of information today. My name is Dave Woodward. I am the National Network Director with Public Leadership Institute and will be your host for today's presentation. I'm also a county official and a former state legislator, and I am personally very interested in seeing how we bring reproductive justice work and an economic frame together to advance policy that not only improves conditions for women, but all of our communities. Just a couple of housekeeping matters before I hand over the presentation to our guests today. Public Leadership Institute is a nonprofit, nonpartisan policy and leadership center, really focused to bring public attention to key issues around equity and justice, and working with public leaders to be more effective in improving the economic and social conditions for all Americans. You can get a lot of information about our work at www.publicleadershipinstitute.org. There you'll find a host of publications, some pictured here on the screen, that there are digital formats, the Progressive Agenda that offers progressive policy solutions for the state and local level, our Voicing Our Values, book that helps public leaders and advocates to better communicate on these important issues shared by all of us, and one of our newer publications, Playbook for Abortion Rights, model policies to really move the needle in advancing abortion rights at the local and state level. All of those publications can be available for download. If you would like a hard copy sent to you, please contact us. If we can make it work, we would love to get the hard copies out to you. Some additional housekeeping. We got a few people that might be joining us for the first time, and we're always glad to see that. We really want to maximize participation in today's session. We do that in a number of ways. If you're joining us from a smartphone, a tablet, a laptop, desktop, what have you, if you have audio capabilities, at any time during the course of the presentation, you can raise your hand, at which time that when we pause for questions, and we'll pause for questions plenty of time to get clarity, share reactions, or frankly address anything that kind of comes to the surface as a result of the presentation today. We'd love to bring your voice into that conversation. If I realize that people join us from a variety of locations, and talking is not always available to us, you can type questions in the question bar, at which time we would be happy to read those questions when we pause. My email, dwoodward@publicleadershipinstitute.org, is up there on the screen. You can email me. It's a little difficult during the presentation to answer, but if there are any additional questions or follow-up, please feel free to reach out, and we'll get your question to the appropriate person afterwards. The other thing that I want to bring attention to on your control panel, you should see 3 handouts that are attached. They're documents that our presenters will be referencing, and you should be able to click on them and download them directly to your desktop so you have them available to you. So unless there's any further questions, let's move on to the, again, like what we said today, that the topic is how to advocate for an economic reproductive justice agenda. And I'm going to introduce, we're really fortunate to have a number of really talented, incredible women who work with the Women Law Center And kicking us off is going to be Gretchen Borschlet. Did I say that right, Gretchen?
Borschelt. Close, yeah, thanks.
Yes. Who is the Vice President for Reproductive Rights and Health with the National Women's Law Center. Gretchen oversees the center's advocacy, policy, and education strategies to promote the quality and availability of healthcare, including reproductive healthcare. Prior to becoming vice president, she served as senior counsel and director of state reproductive health policy, directing the center's state-based legal and policy efforts to protect and expand access to reproductive health care, and linking the work of the center's federal reproductive health advocacy. Prior to joining the center in 2005, she worked at Physicians for Human Rights and was a Women's Law and Public Policy Fellow at the National Partnership for Women and Families. She's a graduate of Columbia Law School and the University of Virginia. And Gretchen, thank you for being with us. We also have with us Erica Hansen, who is currently a Women's Law and Public Policy Fellow with the National Women's Law Center. And both these women are going to present information as soon as I introduce one last person. And Kelly Garcia, the senior counsel for the National Women's Law Center, joined the center in 2009 as a law fellow and was promoted to counsel focusing on healthcare reform implementation and preventing discrimination in healthcare. She subsequently worked as a law fellow at the O'Neill Institute for National and Global Health, where she worked on scholarship related to global health and human rights, healthcare reform, and the Family Medical Leave Act. She returned to the center in 2012 and now oversees the center's efforts to address religious restrictions on women's access to reproductive health services, including its work on hospital mergers and crisis pregnancy centers. She holds a law degree from Yale Law School, a PhD in social psychology from the University of California, Los Angeles, and an AB from Princeton University. I feel woefully inadequate. I'm so impressed to be with all three of you today, and why don't I hand over the control directly to you, Gretchen?
Yes, please. Thank you.
All right. There. You should be able to take the reins.
I've got it. Do you see my screen?
Yep, we see your screen. So you're ready to start. And when we're ready to transfer over to somebody else, just give me the cue, and we'll do that.
Okay. Thanks so much, Dave. Hi, everyone, and thanks, Dave, and thank you so much, PLI, for inviting us to present to all of you, and to all of you for taking the time to join us. I think Dave set it up perfectly in saying that really now, given the women's strike yesterday and International Women's Day, it's perfect timing to come together to talk about women's economic security, how it connects to reproductive health care, and how you all as legislators and advocates can really push forward proactive policy solutions in the states that make those connections in a way that is meaningful to individuals. So we're going to talk to you today about advancing a women's economic agenda in the states that includes reproductive health. And there's really a critical need now for state and local legislators to recognize and embrace that connection and to push forward policy solutions that fit reproductive health within this broader women's economic agenda. So the way we're going to divide up today, I'm going to start by talking about the connection and the links between reproductive health and economic security, and about public perceptions and acceptance of that link. And then I'm going to turn it over to Erica, who's going to discuss some specific policy solutions that fit into a broader women's economic agenda that specifically forward reproductive health. And then finally, Kelly's going to wrap us up by talking about some state examples and giving some lessons learned about how some of this work is moving forward in a few states. So we will go ahead and get started. First, I do have to say a little bit about the center. For those of you who don't know us, we are in Washington, D.C., and the National Women's Law Center has been working for more than 40 years to expand and protect and promote opportunity and advancement for women and girls at every stage of their lives. So whether it's at school, at work, at home, in retirement, in communities, wherever they are, we are here for women. And of course, our work takes many forms. So we work with state and federal legislators to pass new laws. We work to enforce laws that are passed that are good for women and girls. We advance our legal positions in courts, and we also conduct campaigns and public awareness efforts to educate and mobilize the public to press for the kinds of policy solutions we think will help women and girls. So I want to start our conversation now by just kind of pausing and talking about why we are discussing this today. And, you know, as we said, given the women's strike yesterday and all the attacks we've seen lately from our new administration and from some of our members of Congress, it's really important to acknowledge that we have a moment here. It's a moment for kind of a new approach that offers a broad-based vision of policies that are going to move women and families forward instead of taking them backwards, which we know a lot of our new federal officials want to do. And, you know, state legislators are increasingly kind of recognizing, as they should, that our workplace policies and that our workplace supports need updates. They're based on really outdated assumptions about who's working, who's staying home, the supports that are needed to make sure families are economically secure. And, you know, the current system just doesn't reflect the realities of women being half the workforce and families depending on women's income now more than ever. They don't reflect the fact that women need to be economically secure, and that we know there's still a lot of discrimination out there in terms of not getting paid as much or being stuck with inflexible schedules with no paid sick and family leave, all of these things, right? It's really an opportunity now. We've already seen it in a number of states where legislators are stepping forward to put forward these broad-based women's economic agendas to respond to all the problems that we see. And we, of course, support all of those agendas, and we want to make sure that they reflect all aspects of women's lives. And so we are encouraging legislators and advocates to make sure reproductive health care measures are part of that. And we do that by kind of walking people through the arguments we're going to talk about now. So first, let's talk about what is the connection? What is the connection between reproductive health and economic security? There's a strong one. We know that there is a connection between reproductive health care and economic issues, both in terms of how much money a woman has in her bank account at the end of the day to pay for what she needs to pay for, and in terms of her future opportunities, her future economic security. And there's a fact sheet among these materials that Dave mentioned at the beginning that really makes a lot of these points. And so let's talk about them for a minute. So one is kind of what I call the micro connection, which is how does the cost of reproductive health care affect a woman's bottom line? We know that health services are expensive, especially for women, right? Women make less than men because of unequal pay practices. Women are more likely to work in low-wage jobs. Women are more likely to live in poverty. So the costs of reproductive health care services hit women really hard. So hard, in fact, that women may have trouble paying for them, may go into medical debt or bankruptcy, or it's going to mean that a woman's going to take a pay cut somewhere, or take a cut somewhere else and pay for something else, or not pay for something else that she would want, like not paying for rent or groceries so that she can afford the reproductive health care she needs. And specifically on birth control, we know that birth control costs can be prohibitively expensive for some women. We have a slide here that we created during the Hobby Lobby discussion where employers were trying to take away coverage of birth control that looked at how many days a minimum wage worker would have to work to pay for these different methods that the bosses wanted to take away from them. And you can see, right, for something like an IUD, which is a more effective form of birth control, has an upfront cost of about $1,000. It's a month of work for a minimum wage worker. So you can imagine that that worker might choose to go without or decide on a less effective but less expensive method. We know that in one study, only 25% of women who requested an IUD actually had one placed after they learned the associated costs. So this was real for people, that they're making these cost comparisons in absence of policies that support it, and having to pick and choose among whether they're going to get the reproductive health care they need or not. Similarly, for abortion, we know abortion can affect a woman's bottom line, and more than half of women who get abortions have to spend the equivalent of more than 1/3 of their monthly income. And of course, abortion is costly, more costly than it should be because of the restrictions that states have put into place. One example is bans on insurance coverage of abortion. Right now, 25 states have a ban on insurance coverage of abortion in the private markets. And of course, in Medicaid coverage, we know that that is a restriction that keeps women from being able to pay for abortions. And so not only is it insurance coverage, but states are imposing a range of other kinds of restrictions that make costs add up for a woman who's decided to have an abortion, like forcing a woman to make 2 trips to the clinic, or forcing her to wait anywhere from 24 to 48 hours. So she has to get a hotel room, she has to arrange childcare, she has to pay for transportation. All of those things add up. And so a woman who has to pay for those things out of pocket may be forced to delay the procedure to raise the necessary funds. And we know that nearly 60% of abortion patients who experienced a delay in obtaining an abortion refer to the time it took for them to make the arrangements and raise the money to pay for it. For some women, it may not be possible. They just may not be able to afford an abortion because of all these expenses that go along with it. And so what does it mean for the rest of a woman's life if she can't afford the reproductive health care she needs? There was one study that showed that women who were denied an abortion were worse off financially 1 year later. And we know that also there's been data that shows that women denied an abortion are more likely to be in poverty 2 years later. So that's the connection that's in a more macro sense between reproductive health care and a woman's future economic security. And we know that having a child is one of the biggest economic decisions a woman can make. It can really derail career education plans. For example, few teenage mothers attend college. One survey found that 1/3 of female dropouts said that becoming a parent was a major factor in their leaving school, because we know that when women have access to reproductive health care services like abortion, like birth control, and are able to plan and space or prevent or end pregnancies that they may not want, then that's going to lead to greater educational opportunities, greater employment opportunities, and greater economic security for women and families. And there are tons of studies on birth control specifically, how that is linked so clearly to increased lifetime earnings, to increases in the number of women who are employed in professional occupations, to increases in women's wages. So there is a connection. There's a clear connection between reproductive health care and economic issues. Again, both in terms of how much money a woman has in her bank account at the end of the day, and in terms of her future opportunities and her economic security. So the next question, of course, is what does this mean for you as a state legislator, as a state advocate? What we need to do is make sure that these connections are recognized and embraced, and that we are pushing forward a women's economic agenda that promotes access to reproductive health care. And there are really 2 reasons why this should be next steps going away from this, aside from the fact that it's just good generally for women and families. One is that we know policy solutions can make a difference. So what we're proposing are actual solutions that will make a difference in women's lives, that will help their economic security, that will push women and families forward. There are ways to really promote access to reproductive health care that are going to help women and families. And Eric is going to talk about some of those specifics in a minute, but I do want to share one example of what we know has made a difference from something at the federal level. Federal level policy, right? The healthcare law's requirement that insurance cover birth control without additional cost to the woman. We know that has made a huge difference for women and families. Before the law passed, women were spending between 30 and 44% of their total out-of-pocket costs just on birth control, but things are different now. They don't have those out-of-pocket costs anymore. And we know in 1 year alone, women saved about $1.4 billion just on the pill. So it's helping women's bottom line, but we also expect to see these benefits go into the future in terms of women being able to pursue their education, to take a better paying job, to participate in our nation's social and economic life because they have access to birth control without copay. So we know that there are policy solutions that are out there that recognize these connections and that make a difference in people's lives. Now, the second reason we should be doing that, pushing forward reproductive health as part of a women's economic agenda, is because we know that the public wants this. People do not live their lives in silos. They understand that all of these issues are connected. There's one survey that showed that a majority of Republicans say that a woman's control over her reproductive health can affect her financial stability. They connect these things, right? They also understand that things are broken right now and that they aren't working, that there are a host of problems across the board, that minimum wage is falling short, that child care costs are a major expense for working families, that low-wage workers are stuck with inflexible schedules and they don't have the paid and sick and family leave that they need. So all of these things are happening at the same time, and they're hungry for solutions. And it's not one policy that's going to help them. People don't believe that there's any one policy that's going to completely change their lives. But they do believe, polling has shown, they do believe that a package of policies will work. A package of policies that recognizes the central role women play in their families and in the economy, and a package of policies that reduces the obstacles women have to overcome. That kind of package would help level the playing field. And so this polling and messaging has shown that when we talk about it as a package of policies that give women and their families a fair shot at getting ahead, that is something that the public wants and will vote for. And then there has been specific polling done by a group called the National Institute for Reproductive Health that shows that voters support women's agendas when they address reproductive health care, specifically abortion. So we have this moment right now. There is a moment to push forward an economic agenda that recognizes that our economy is not working for women and families, that recognizes that the policies and the social supports we have are based on these outdated assumptions about who's working and who's staying home, and that recognizes that women are trying to get ahead but still facing discrimination and barriers, and that those need to be knocked down. So we encourage all of you to seize this moment that we have to think about introducing proactive, broad-based women's agendas that include reproductive health care. It's really an opportunity now to put forward a vision for what we think individuals need in this country, and to respond to some of what we saw in terms of dissatisfaction and restlessness with the status quo and the way things were. That we need a vision for progressive policies that people can stand behind. So with that, I will pause, and I will ask Dave if he can turn it over to Erica, who's going to talk about some of their specific policies that could be part of this vision for moving things forward for women and families.
Excellent. And we'll hand that over right now. And Erica, you should be able to.
All right, can you see my screen?
We can.
Okay, well, thank you so much, Gretchen, and thank you, PLI, for having us. Can you guys see my bottom, the bar? Is that gone?
I cannot see the bottom bar.
Okay, perfect. So as Gretchen said, I'm going to highlight some of the specific policies that advance reproductive and economic security for women and their families. But before I do that, I want to draw your attention to this great resource we have for advocates and policymakers who are interested in advancing a women's economic agenda that includes reproductive health. This is our state roadmap to economic justice, and you can see it over in the handouts in the webinar section, as well as on our website. And this state roadmap puts forward a broad-based economic agenda that recognizes the interconnectedness of the different factors that affect the economic security of women and their families, and outlines a policy agenda that will improve their lives. So in the roadmap for each policy, you will see a summary of the problem, key legislative strategies to address the problem, the research basis for why this policy makes sense, information on what states are currently doing, and talking points for making successful arguments with policymakers, the media, and the public. So this is a great resource to kind of get a good overview of more policies than the ones that we're going to touch on today. So now I just want to highlight a few of the types of policies that states and localities can and have implemented to promote women's reproductive and economic health. I want to emphasize that women's economic agendas can be very broad. So for example, repealing a bad abortion restriction would advance women's reproductive and economic health, so that could be considered part of a women's economic agenda that includes repro. But we have selected these policies to highlight simply because they are policies that states and localities have been successfully passing and packaging together. And they send a strong message that lawmakers recognize the importance of reproductive health for women's economic security. So first I'm going to start with policies that specifically expand access to affordable reproductive health care. And the first policy is guaranteeing comprehensive insurance coverage of birth control. So as Gretchen mentioned, currently the federal health care law, the Affordable Care Act, does guarantee insurance coverage of birth control with no out-of-pocket costs. And we have seen great benefits to women's health and economic security as a result. But states can have a role in protecting women's health as well. Obviously, there's a lot going on at the federal level with the ACA and potentially the birth control benefit. And although no single state bill will be able to provide the far-reaching protections and benefits of the ACA, states can pass laws to mitigate the harm to women in their state if the ACA is repealed or if the birth control benefit is changed in some way. So states have been stepping up to ensure that access to affordable birth control is guaranteed in their state, regardless of what happens at the federal level. So states like California, Illinois, Maryland, and Vermont have already passed laws that enshrine the birth control benefit into state law. And these laws go even beyond the federal requirements to remove further barriers to birth control access. So that's a great way for states to improve the reproductive health and economic security of women in their states. A second policy I want to highlight is insurance coverage of abortion. As Gretchen mentioned, there are 25 states that currently prohibit insurance coverage of abortion in private plans, and there is a federal prohibition on Medicaid coverage of abortion. But states can use their own funds to pay for abortion coverage in their Medicaid programs, and 17 states currently do so. So there is room for improvement to provide this needed insurance coverage for abortion for women in your state. As Gretchen mentioned, access to birth control provides health benefits for women and children, improves women's ability to control whether and when they have a child, and fosters women's ability to participate in education in the workforce with equal footing with men. Likewise, women that have decided they need an abortion are able to obtain one are better off than women who are denied an abortion. They are more likely to be employed and less likely to be living in poverty than women who were unable to obtain the abortion they wanted. But in order to plan their families, people must be able to afford reproductive health care, including birth control and abortion. And as Gretchen mentioned, reproductive health care can be costly. And studies have shown that even small cost barriers have a negative impact on access to reproductive health care. So for example, out-of-pocket costs as low as $6 can discourage women from continuing their use of birth control. So these policies guaranteeing insurance coverage of reproductive health care services remove these cost barriers, and they protect and encourage both the reproductive and economic health of women and their families. So now I'm going to move on to some workplace policies that, while they may not be thought of as traditionally reproductive health policies, they do, in fact, protect and enhance women's reproductive and economic health. So these are just a few examples of those workplace policies. The first policy is reproductive health non-discrimination. This is a bill that would specifically prohibit employers from taking adverse actions against their employees because of their employees' reproductive health decisions. So for example, people have been fired because an employee and her husband used in vitro fertilization to become pregnant. They've been penalized for using birth control. They've been taken adverse action against because of a decision to have an abortion, or they've been threatened for having sex or becoming pregnant outside of marriage. So this bill would prevent that type of discrimination and hence free a woman to make the best decision about whether and when to have children for her and her family without fear of repercussion in the workplace. A second workplace policy that I want to discuss that's been very popular is pregnancy accommodations. These ensure that pregnant women can continue to do their jobs and support their families by requiring employers to make the same sorts of accommodations for medical needs arising out of pregnancy, childbirth, and related medical conditions that the Americans with Disability Act, or ADA, requires employers to make for disabilities. So many pregnant workers need only simple accommodations, but even these are frequently denied, such as being permitted to sit down during a long shift, having water at a workstation, avoiding heavy lifting, and staying off high ladders. So when states adopt laws that explicitly require employers to make reasonable accommodations for medical needs arising out of pregnancy, pregnant women can continue to do their jobs and have a healthy pregnancy. Third, I want to talk about family responsibility or caregiver non-discrimination. This policy prohibits employers from taking adverse actions against employees based on their family responsibilities. So, for example, an employer may refuse to hire a job applicant after asking her about whether she has children, may demote a mother after she returns from maternity leave, or may pass a working parent over for a promotion based on the stereotype that parents are less reliable. Caregiver discrimination in this way also affects the growing number of individuals caring for elderly relatives. And because women continue to do the majority of caregiving for children and other family members, this protection ensures that they can fulfill their caregiving responsibilities without fear of retaliation at work. Finally, I want to talk about fair scheduling. This is a big issue, especially for low-wage workers, as inflexible workplace policies can force a woman to choose between her caregiving responsibilities and her job. So laws that require employers to give their employees advance notice of work schedules, the right to request a change in their schedules without fear of retaliation, and that limit last-minute scheduling changes ensure that parents can stay employed and still meet their caregiving responsibilities. So workplace policies like these allow women to decide whether and when to start a family and allows them to sustain a family with economic stability. And this is important in advancing both women's reproductive and economic health. Because as Gretchen mentioned, the decision of whether, when, and how to have children is one of the biggest decisions many women will make in their lifetime, and women shouldn't have to worry that the decision could cost them their jobs. Furthermore, policies like these benefit the entire state economy by protecting the buying power of women and their families and harnessing the full potential, talent, and productivity of the workforce. So when women are able to enter and remain in the workforce, the state economy grows. So that's just a short sampling of different policies that have been successfully passed and packaged in states and all that impact women's reproductive and economic health positively. So before I kick it to Kelly to describe some of our case studies in actual states, we're going to pause for questions for either me or Gretchen or Kelly. So back to you, Dave.
Excellent, excellent. Yes, and so if people have any questions about any of the stuff that's been presented either by Gretchen or Erica at this moment, raise your hand if you have audio capabilities or type questions in the question bar. I think this is, I think the frame of reproductive justice issues as it directly connected to economic well-being, not only a woman and her family, but the connection to local community is quite persuasive. And and you shared already that there's actually broad, bipartisan support for some of these solutions. So type questions in the question bar or raise your hand, and we'll take those questions as they come in. A lot of folks who join us. Being shy has never been one of them. Got a question here. Susan asks, have we, in the wake of the last presidential election, have we seen an uptick of these proactive strategies being led by either advocates or public leaders at a state and local level? And so maybe kind of open-ended, Gretchen or Erica?
Hi, this is Gretchen. That is kind of a great question to segue to our next presenter, which is Kelly Garcia, who's going to talk about what we've seen at the state level and some of the successes that we've had already and what's been going on. And so, Kelly, hopefully you can kind of talk about what we've seen post-election in terms of more states being interested in this really, building momentum given the attacks we've seen at the federal level. So can we kick it over to Kelly to weave that into her remarks? That would be great.
Sure. Why don't we do that? And people, if you do have any questions, we don't have a lot that are coming through at this minute. So Kelly, why don't we hand it over to you?
Okay.
If I can. Where'd you go? There you go. We'll hand it over to you. Perfect.
Okay, great. Thank you so much. And that was a perfect question to segue into my part of the presentation. So I think I'll start first by kind of addressing that question a little bit. And I think you're absolutely right that that after the election, there's really been a hunger at the state and local level for these kinds of proactive active bills. This is a place where in the states and in localities that people feel like they can make a difference, that they can start changing the conversation, that you can take back the conversation in a way that might feel a little daunting and more challenging when we're thinking about the federal level. So I think we've definitely seen in UpTech, I've certainly seen a real interest from the state advocates that we work with in terms of trying to do proactive policies kind of across the board. And so kind of segueing into what I specifically wanted to talk about today was two states in which we have seen women's economic agendas be introduced, and once they were passed, and that have included reproductive health, and have really talked about the totality of women's lives and the need for protections for reproductive health when we are thinking about women's economic security and the links between women's ability to access reproductive health care and their final economic security. So first today, I'm going to talk about Delaware, which introduced a women's economic agenda last year and was able to pass their economic agenda last year, and then move to Oklahoma, which is a very different state, and has introduced a women's economic agenda that's kind of still working its way through the legislature. And I think what's nice about kind of these two is they happen, one before and after last year and this year, and one before the election, and kind of what is going on after the election, particularly in what we're seeing in red states like Oklahoma. So first, talking about Delaware. So last year, we were approached by legislators in Delaware who were interested in moving some proactive bills, and were really particularly knew that they were in a position to be able to pass pass these bills. And so we sat down and we talked through with the Delaware legislators to think about what really makes sense in their states. And so I wanted to spend a little time kind of going through what that process looks like, because it is the kind of process that we want to think about when we're trying to come together for what could be a really good women's economic agenda in an individual state. And so we really, in Delaware, they were really in a position to be able to pass their bills. So we wanted to sit down and think about what kind of protections were needed in Delaware, specifically looking at where were there holes in existing laws that leave women vulnerable to discrimination or make it harder for them to be able to achieve economic security. And then we have a separate question, which was to really think about whether or not we wanted to do an omnibus bill, so a set of bills that packaged all of one bill that would package all of these things together, or if we would want to do a set of different bills. So in Delaware, we ultimately decided that it made more sense to have 3 separate bills, to not have an omnibus bill, but those bills were going to really be talked about and packaged together as a women's economic agenda. And so the policies that we ultimately and the legislators ultimately agreed on were pay transparency. So that would prohibit employers from discriminating or retaliating against their employees if they discuss their wages with other employees. And then the Reproductive Health Non-Discrimination Act, which Erica has already talked about, but prohibits discrimination. Prohibits employers from discriminating against their employees because of their reproductive health decisions. And then finally, a prohibition against discrimination because of family responsibilities or caregiver responsibilities, which again, Erica had already talked about. And so these three bills were places where Delaware really did need to fill in some gaps in their existing laws and include protection and make sure that women were protected and that would allow us to advance women's economic opportunity. And they were a nice set of bills that really let us talk about the importance of preventing discrimination in the workplace so that women are able to make the decisions about whether and when to have children and be able to raise their children and have and obtain economic security. These 3 bills, when you look at them together, they're really about making it possible for women to be able to support themselves and their families and be able to make the decisions about their child rearing that's best for them at the time that is right for them. And to be able to enter into and remain in the workforce regardless of whether or not they've had children and regardless of their reproductive health decisions on a whole. Right, when you think about kind of how the reproductive health discrimination, allowing women to make that decision without fear of discrimination hangs together with the fact that women also need to be protected against discrimination because of their caregiving responsibilities and be able to earn a living wage and support themselves, which really gets at which the pay transparency helps protect. So these bills highlight the ways in which discrimination in the workforce in Delaware could make it harder for women to decide to have children, to decide not to have children, and to be able to raise and care for themselves and their families. And so it was a nice set of bills that we were able to talk about women's lives really broadly. And this let us work with a broad and good coalition of advocates that were coming from a lot of different places but could stand up and really want to support these bills and be able to talk about the importance of reproductive health to women's economic security. And so, for example, we helped pull together sign-on letters that included organizations as diverse as the Delaware Association of University Women, as well as the ACLU and A Better Balance. And so really kind of be able to highlight the breadth of support of these bills. And we also were able to help facilitate testimony from Lily Ledbetter so she could talk about pay transparency and her experiences, but also be able to talk about and pull in the reproductive health non-discrimination and the family responsibility discrimination. Excuse me. And what was really the way it worked in Delaware is the bills were all able to be introduced at, so even though there were 3 separate bills, they were all introduced at the same time, and they moved through the legislature together, and then were voted on the same day, and were able to be signed all on the same day. And so it really was, although they were 3 separate bills, really was a package of bills that were talked about together and were able to highlight the importance of economic security and reproductive health to women's ability to care for themselves and be able to make the decisions that are best for them. So when I skipped a slide, but we were able to, the picture of Lily Ledbetter, who was able to come and speak at the bill signing. And again, this highlighted kind of how we were able to kind of really bring in and pull together people that really we traditionally really think about as talking about pay transparency and employment discrimination, but also pull in the reproductive health aspect as well. And so this was a nice broad coalition that included a nice broad set of bills. And then moving on to Oklahoma. So Oklahoma is in a different place. While they want to look for and think about bills that do have a chance of passing, we recognize that it's in a much more hostile environment, and it's going to be a much more uphill battle. So in this case, in trying to think through what the bills are going to be, and particularly thinking through post and after the election, there's this opportunity to really say, we're going to go left. We're going to go left for where we are in Oklahoma and really think about how it is to start having a conversation and move the conversation forward, both about women's economic security as well as reproductive health and rights within Oklahoma. And so in this instance, we have worked primarily with, and the effort has really been led by the Oklahoma Coalition for Reproductive Justice. And they wanted to also put together a women's economic agenda. They are a reproductive justice group, so they are really thinking about reproductive justice and reproductive health from this broader perspective that really recognizes the importance of women being able to make decisions for themselves with autonomy and dignity, and that means that you need economic security. And so they also came together and put together these bills, which include the Reproductive Health Non-Discrimination Act and workplace pregnancy accommodations. And once again, this set of bills and this package lets us talk about ways in which discrimination can stand in the way of women's economic security, which includes women's ability to make the decisions for themselves, the reproductive health decisions that are best for themselves. But it also lets us, really lets us call out and recognize the need for support for women to be able to enter and remain in the workforce. And so this bills, we have, again, this bill, somewhat contrast to Delaware, has really been led by the reproductive justice groups, it has been led by OCRJ. And so as they're pulling together the bills, the bills were put together while they're talking about them as a package. We have branded and put together materials and talking points and fact sheets that do talk about these bills as a package and the need for supporting women's economic security. The approach here has been a little different in that the bills aren't moving together in the same kind of lockstep way that they were able to move forward in Delaware. So the bills have been introduced. They're currently in committee. They have separate and different sponsors and are both being talked about together by OCRJ as this package, but also are being talked about are also able to be talked about separately as how they help and combat discrimination kind of independent of each other, but also come together. And this just kind of reflects the realities of both kind of the different states and the different coalitions and the different places they are at. But let's, again, we have these two bills that we're able to pull together as a package, talk about the importance of women's economic security, talk about the importance of reproductive health for women's economic security, and talk about the way in which discrimination against women can make it harder for them to make those decisions for themselves about whether and when to have children. And with that, I'm going to turn it back over to Gretchen to talk a little bit more about what we at NWLC can do.
Thanks, Kelly. Yeah, I'll be quick here because I know we're getting close to time, but just to reiterate some of what Kelly highlighted in her remarks. So the National Women's Law Center is here as a resource for state legislators, state advocates, and we really can provide a range of technical assistance and kind of attention to what's going on in your state. So we can help state advocates, state legislators think of policy solutions that will help women and girls at the state or local level. And Kelly talked about how we did that in Delaware and Oklahoma, trying to figure out what are the problems, what needs to be responded to. We can tell you what other states have done. We can help draft the bills. We have many lawyers here on staff that have the expertise in drafting legislation and tailoring it to the state, making sure it's the right fit there. We can provide the materials that folks need, talking points, fact sheets, whatever else is helpful to make the case. And we can also provide data that's relevant for your state. So we have policy analysts that can crunch numbers, whether it's number of women uninsured, pay gap in your state, whatever it is that's relevant to the policy that is being pushed there. And all of that technical assistance we can do either behind the scenes or we can play a more active role. So sometimes, as you saw in Oklahoma, we co-brand things. Sometimes we are totally behind the scenes. Sometimes we go in and testify in support of legislation where legislators think that would be helpful to have us out in front of something. So it really is, a consideration, and we're all about deferring to the state legislators and state advocates in terms of what's most helpful for them. Because at the bottom line is that we want this policy to be enacted in the state, and so we'll do what we can to make sure that happens. And then the other way we can help is to bring attention to what's going on in the state or local level. So we have a blog, we have extensive social media reach through our Facebook and Twitter and other social media platforms, so we can highlight good things that you're doing. We can also engage and enrage folks if something bad's happening. We can either draw attention to it or we can specifically activate folks in the state if necessary. We talk to press all the time and highlight for them what's going on in various states. So just to remember that we are here to do that as well, and hopefully, get these policies passed and get them the attention they deserve. So with that, we will be happy to take any other questions people have and encourage all of you to continue to think of us as a resource for your work going forward.
Great, thank you. Thank you very much, Gretchen and Kelly and Erica and everybody. If folks have questions, you can type questions in the question bar or raise your hand and we'll get to the questions that are coming through here. Kate asked the question, specifically to the non-discrimination policies. What methods of enforcement were attached to these non-discrimination policies? And is asking basically to see if they, how they, as a result, how do they effectively alter working women's material conditions? Do you want to speak to some of the enforcement strategies that are built into these policy solutions?
So sure, this is Kelly. So we do try to build the non-discrimination bills into the existing anti-discrimination regimes that are in the states. Although I will say we do look to try to ensure that we want there to be a private right of action for the non-discrimination bills that we are putting forward, as well as we look to see some states, for example, they might, the protections, their existing protections might only apply to employers that only have 5 employees. We would really like to see, or sometimes it's 10 or 15. We do try to look to see, and we would prefer that it applies to employers as small as only having 2 employees. But we do, our as we're thinking through and working with the legislators or the policy advocates, we do kind of try to think through what is realistic in your state in terms of being able to get the bills passed, but also and how we can fit it into your existing anti-discrimination laws and plans, but also when there's opportunities to really try to improve upon what's already there.
It might be helpful if I unmute myself.
Okay, great.
Now, another question. I think the examples that were given, state favorable conditions to advance economic justice, reproductive justice policy, and I mean the example you gave with Oklahoma, maybe less favorable on the surface, but can make the case over a long term. Have you had any experience or seen any success maybe even starting in some local communities and to make the case for statewide action?
So this is Gretchen. I will talk about a really interesting model that we saw out of Mississippi where they were thinking about, okay, we know that there are problems facing women and families and they're not economically secure. How do we figure out what those problems are and how do we build a case for it? And so in their state, what they did was hold a series of town hall meetings and discussions in local communities throughout the state. And they talked to the folks who went. So citizens, interested parties, came together and sat down and talked through, okay, what are the most pressing economic issues you're facing? Why are you feeling like you're not economically secure? What's missing? What kind of policy solutions make sense? And so they really built that from the ground up and talked to the people who would be most directly affected to find out what their legislators needed to know and the kinds of solutions that would work for them. I think that's a great model for going from the ground up and building it up to legislators. Oftentimes we work from the top down, right? And so I think that we've had folks from Mississippi present on the way they did this. They filmed the discussions. So they had the evidence, and now they have this community of people who are very invested in this process. That's a state where it's going to take a long time to push it, and so having those people invested going forward is really going to help along the way as they try to keep moving this. But there are different kinds of models like that I think are developing as we hear more and more states picking this up. And I think it's great to share those kinds of models with other states so they can consider what's right for us and which way should we do it.
Right. Great. And if folks have additional questions, again, be sure to bring your attention to the handouts that are attached to your control panel in the GoToWebinar control panel, and make sure you download those documents. Those documents are also available at the National Women's Law Center on their website. If you have any questions, raise your hand or type questions in the question bar. I think all three of you were very thorough in presenting the stuff, and so we usually have a little chattier group, but they're still there.
Well, we're also happy to be here. If a question occurs to people later and they want to shoot us an email or be in touch, we are, of course, happy to help in any way that we can. And certainly thinking of strategies, and like Kelly and Erica both said, depending on what's right for an individual state. Another state where there's been some interesting movement is Georgia, where they're actually started with a resolution that just makes the connection, talks about the connection between reproductive health and economic security. And so it's a way to kind of put a marker and start to talk about the issues, but without necessarily having the bills all figured out. So there are a bunch of different ways to approach this, and we know that there's a lot of interest right now among the public in seeing these connections being made. So we are, again, here to help in whatever way makes sense for your state to move this conversation and these policy solutions forward.
Great. Well, wonderful. Well, thank you all very much. I think this is incredibly informative. I think it's some concrete tools I think, Gretchen, as you said, is to stoke the conversation that has utility at a local and obviously a statewide level, to get the conversation moving and do so in a way that meets people where they already are, where there's already huge support, and can be as much a organizing tool as a advocacy focus. Moving forward. So I will give you each the last word, and we'll wrap up. And if there are any additional questions, you should reach out to all three of these experts in this area and use them as a resource, and the National Women's Law Center as a tool and a resource to help support your individual work. So give you each the final word, and we'll wrap up.
Just a thank you to you, Dave, and to PLI for hosting us. And we look forward to coming back to talk about other initiatives and to improve women's lives in other ways.
Sounds great. Sounds great. Well, thank you, Gretchen. Thank you, Erica. Thank you, Kelly, for your time. Like I said, very informative. Make sure people download the handouts, and stay tuned for future Public Leadership Institute policy leadership webinars brought to you every 2 weeks. Generally Wednesdays, but this one on Thursday. So keep on the lookout on your emails. Thank you again, and look forward to seeing everyone next time.